CNA Denture Safety Precautions. Welcome to the quiz. Question 1. You're about to enter a resident's room to provide care. You knock on the door and hear a faint, "Come in." Upon entering, you find the resident and their spouse in an intimate embrace. What should you do? Option A. Apologize quietly. Say, "I'm so sorry. I'll come back later," and leave the room immediately, closing the door behind you to give them privacy. Option B. Tell them this behavior is not appropriate in a nursing home and they should wait until visiting hours are over. Option C. Proceed with your task as quickly as possible, ignoring the situation to show it's normal. Option D. Stand in the doorway and ask when a better time to return would be. The answer is A. Respecting privacy and intimacy is essential. Option A is correct because it respects their privacy and intimacy. Option B is incorrect because it's judgmental. Option C is incorrect because it invades privacy. Option D is incorrect because lingering is intrusive. Question 2. A family member of a resident confides in you that they are feeling extremely guilty about placing their loved one in the nursing home. What is your most appropriate response as a CNA? Option A. Listen empathetically without judgment and say, "This is such a big adjustment for families. It sounds like you're feeling very torn and guilty. Those are very normal feelings. Would you like me to let the social worker know you might want to talk to someone about how you're feeling?" Option B. Reassure them that their loved one is in good hands and they have nothing to feel guilty about, as this will make them feel better. Option C. Tell them that you're not qualified to discuss feelings and they should speak to the social worker, then change the subject and walk away. Option D. Agree with them that it's a difficult situation and suggest they visit less often to ease their guilt. The answer is A. Empathy and appropriate referral are helpful. Option A is correct because it offers empathy and an appropriate referral. Option B is incorrect because false reassurance minimizes. Option C is incorrect because abrupt referral dismisses feelings. Option D is incorrect because suggesting less visits is not helpful. Question 3. You are assisting a resident with ambulation who suddenly becomes weak and begins to fall. What is the most appropriate action to ensure both your safety and the resident's safety? Option A. Quickly move behind the resident, grasp the gate belt securely, and gently lower them to the floor, bending your knees and keeping your back straight to protect your own back and control the fall. Option B. Step back and allow the resident to fall to avoid injury to yourself, then call for assistance to help them up. Option C. Attempt to stop the fall by grabbing the resident's arm and pulling them back upright, using your body as a strong support. Option D. Shout for help immediately while trying to hold the resident up, hoping another staff member arrives before you both fall. The answer is A. Controlling the fall protects both the resident and yourself. Option A is correct because it controls the fall, protecting both. Option B is incorrect because allowing a fall is unsafe. Option C is incorrect because grabbing an arm can cause injury. Option D is incorrect because hoping for help is not reliable. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 4. While providing perineal care to an incontinent female resident, you notice a raised area with a small amount of white discharge in the labial folds. What is your priority action? Option A. Gently clean the area from front to back using a soft cloth and peri-wash. Dry it thoroughly and report your observation of the redness and discharge to the nurse immediately after finishing care, as this could indicate a yeast infection needing assessment. Option B. Document the finding in the resident's chart and continue with your duties, as this is a common finding. Option C. Ignore it, as discharge is a normal finding in incontinent women, and continue with the care. Option D. Clean the area thoroughly with antiseptic wipes and apply a thick layer of barrier cream to treat the possible infection. The answer is A. Proper cleaning and reporting are essential. Option A is correct because proper cleaning and reporting are essential. Option B is incorrect because documenting alone is not enough. Option C is incorrect because ignoring could miss infection. Option D is incorrect because antiseptics and barrier cream may not be appropriate. Question 5. A resident with a history of dysphagia begins to cough and has wet-sounding respirations while eating lunch. What is the most immediate and crucial first step? Option A. Instruct the resident to stop eating immediately and lean forward slightly to encourage effective coughing and clear their airway. Stay with them and observe closely. If the cough doesn't clear, call for help. Option B. Encourage the resident to take a sip of water to help wash down the food that is causing the cough. Option C. Leave the resident to go get the suction machine set up at the bedside. Option D. Slap the resident firmly on the back to dislodge the potential obstruction. The answer is A. Encouraging natural clearing and monitoring is the first step. Option A is correct because it allows natural clearing and monitoring. Option B is incorrect because water can cause aspiration. Option C is incorrect because leaving is unsafe. Option D is incorrect because back slaps are for complete obstruction. Question 6. You're assisting a 78-year-old resident with a history of CHF and dizziness to ambulate to the dining room. Halfway there, she stops, leans heavily on her walker, and says she feels very dizzy and like her heart is racing. She is pale and diaphoretic. What is your immediate priority? Option A. Ask her if she took her water pill this morning, as dizziness is a common side effect, and suggest she drink some apple juice in the dining room to boost her blood sugar before continuing. Option B. Quickly pivot her around and hurry her back to her bedroom so she can lie down, as getting her off her feet is the priority. Then go find the nurse to report what happened. Option C. Encourage her to keep walking slowly to the dining room so she doesn't miss her meal, as nutrition is important, and report the incident to the nurse after she is seated. Option D. Recognize these as potential signs of cardiac distress. Immediately instruct her not to move, gently lower her to a nearby wheelchair or to the floor against the wall to prevent a fall from fainting, stay with her, and call out loudly for another staff member to get the nurse stat. The answer is D. Stopping the resident and preventing a fall is the priority when someone shows signs of fainting. Option A is incorrect because asking about medication and suggesting juice delays addressing the acute symptoms and does not ensure safety. Option B is incorrect because quickly turning and walking back could worsen dizziness and increase fall risk. Option C is incorrect because continuing to walk could lead to fainting and a fall. Option D is correct because it prioritizes resident safety by preventing a fall from syncope and immediately summoning help. Great job! Don't forget to subscribe. Bye!